On behalf of Beaumont Health System, my name is Dr. Chris Wilson. I'm a physical therapist at Troy Beaumont Hospital. I'm also an assistant professor at Oakland University. I have the distinct pleasure today to be talking to you today about the role of rehabilitation in supporting cancer survivors throughout their recovery. Before we start talking specifically about cancer survivorship in rehabilitation, I want to read to you the definition of cancer survivorship. The National Coalition for Cancer Survivorship pioneered the definition of a survivor from the time of diagnosis and for the balance of their life. A person diagnosed with cancer is a survivor. This expansive definition of survivor also includes people who are dying from an untreatable cancer. The National Coalition for Cancer Survivorship later expanded this definition of survivor to even further include family, friends, and voluntary caregivers who are affected by the diagnosis in any way. Now that we've clarified the definition of survivor, let's talk specifically about what rehab does for cancer survivors. Rehabilitation is not commonly thought of when we talk about cancer survivorship. Things like chemotherapy, radiation, and surgery are more commonly thought of as interventions. Beaumont has a very unique approach to cancer rehabilitation called PRISM, standing for Prevention, Intervention, and Sustainable Wellness Model. This incorporates a comprehensive approach to care, which is proven to work with disease-specific processes in a large setting. The goal of PRISM in rehabilitation supports patients and their families through an integrative practice and education before, during, and beyond treatment. You can see on this slide here, the PRISM model of care is an evolution of normal oncology or cancer rehabilitation to that model of prevention, intervention, as well as sustainable wellness for the duration of a person's life. Let's talk specifically about the benefits of regular exercise. In a cancer survivor, and yes, for all of us, regular exercise and diet control can decrease fatigue, side effects, and maintain strength. It will also lower blood pressure, blood sugar, and cholesterol, and relieves tension and stress, increases our metabolism, strengthens the muscles and the heart, which is also a muscle, and also reduces cancer-related fatigue. Every person for a cancer survivor should have an individualized written survivorship care plan. This was declared by the Commission on Cancer in 2012. What is a cancer survivorship care plan? Well, it should include things like your course of recovery, information on late-term effects, recommendation follow-up screenings, referrals to other providers, and finally, specific recommendations for healthy behaviors. Well, we all know exercise is important and maintaining a healthy lifestyle is also important, but we all have barriers. Some of the barriers we're going to talk about today and what we can do to try to address them. One of the barriers we commonly hear, I simply don't have time to exercise for 30 minutes a day. The solution to that barrier, hopefully, would be it doesn't have to be 30 minutes a day all at once. You can start with 10 minutes a day, maybe even work up to 10 minutes 3 times a day, with the ultimate goal of working out 30 minutes a day for 5 days per week. I'm too tired after work. Very common for all of us. Try and plan your exercise before work or maybe at lunchtime when you have energy. Or again, intersperse it throughout the day. I'm too shy to exercise in a group. You don't need to exercise in a group. You can follow an aerobics class on TV or even go for a walk. Walking hurts my knees, and you can replace knees with back, shoulders, hips, toenails, hair, whatever body part ails you. There is an exercise for you. You can try chair exercises or swimming, to name a few. I'm afraid I'll make my condition worse. That is a very real fear for anyone who has any type of life-threatening condition or a serious medical issue. And it's important to get a doctor's checkup to learn what exercises or activities are safe for you. So let's talk a little bit about side effects of cancer and its treatments. Certainly one of the #1 side effects that people complain about are pain in the joints, muscles, headaches, or body aches. Fatigue. Fatigue is a very real issue and can last for weeks to years after cancer treatments. Lymphedema, which is a swelling of an arm or a leg. Joint stiffness and loss of flexibility, decreased endurance or deconditioning. This might be from chemotherapy toxicity or recovery from other treatments. Finally, decreased balance, and this could also be from deconditioning, medications, or weakness as well. Decreased strength. This might be associated with your surgery, radiation, chemotherapy, or overall deconditioning. Difficulty sleeping or insomnia is another side effect of cancer. Another one that's kind of underestimated is mental fogginess. This might also be known as chemo brain, and this might be difficulty with word finding, processing, or just simply feeling like you're firing on all cylinders mentally. Memory deficits or inability to find words. Also, a fear of recurrence is a very real cancer when somebody went through a cancer experience. And there's a fear that any pain might mark the return of the cancer. Let's talk a little bit about life after cancer. This has been a big thing that's been happening for an individual, and there are some things we need to do to cope with it. Give yourself permission to feel exhausted, overwhelmed, scared, sad, or happy 1 minute, and maybe crying the next minute. It's okay. Embracing the ongoing journey of discovering who you are now and who you will become. Adjusting to your new body, taking time to grieve loss of a body part or new challenges of new or altered body parts. Reduce your obligations. Give yourself a chance to hit that reset button where you're changing your expectations. Slow down a little bit. Learn to be gentle with yourself. And then importantly, plan to annually celebrate another year of successful living after cancer, courage, and your accomplishments. Also, after cancer, we want to work to avoid stressful events or situations. Sometimes they're unavoidable, but we should really be trying to work to avoid stress at all possible for all of us. Do something for yourself. Bring home beautiful flowers, meet up with friends, spend some time with a friend, plan a vacation. And just take time to focus on yourself. Some people find journaling is an appropriate outlet. And then make sure you're doing activity. When you have energy, kind of strike while the iron is hot, and give yourself permission to rest when you are tired. But also keep in mind that some exercise is going to be better than no exercise. Let's talk a little bit about cancer-related fatigue as a topic. It can be caused by pain, emotional distress, insomnia, low blood levels, poor nutrition or appetite, even a decreased activity level. If we don't exercise enough, it can cause fatigue or deconditioning, and then simply a sedentary lifestyle can cause that as well. You can also get fatigue as a side effect of your body repairing itself after your cancer treatments, or even other related or unrelated medical problems. If you have had cancer-related fatigue for more than 2 weeks, you'll want to contact a medical professional. The symptoms include generalized weakness, or you might be exhausted for several hours throughout the day. If you're not motivated to engage in your usual activities. If you have difficulty falling asleep, if you sleep too much, or if you wake up and you found that your sleep was not refreshing, or it might make you rest or nap several times throughout the day. If you have mood changes like frustration or sadness or irritability with your fatigue, or difficulty completing your daily tasks due to fatigue. If you find that your home life or work life or recreational activities are affected by your fatigue, or having memory or concentration issues. These are all problems and we shouldn't ignore them. If you think you have cancer-related fatigue, you should be exercising. Exercise 6 days a week. Lower your other obligations or expectations. Pace yourself. Find out when a good time to exercise is or when you're tired. Pay attention to those energy swings and patterns. Try and fit in power naps and eating a healthy diet. Those are all good strategies in potentially improving your fatigue. Go to bed earlier than usual, and again, talk with your physical or occupational therapist or your doctor to determine if other tests or medications are needed. Let's talk a little bit about exercise. Exercise is one factor within your control that can make a very real difference in your life. We're going to talk about how to start exercise. One of the things that a lot of us learn when we are children is no pain, no gain. If an exercise isn't hurting, you're not doing it right. That is incorrect. You should be avoiding no pain, no gain. If an exercise or an activity hurts, do something else. Track your progress by setting goals and journaling your workouts. You'll also want to calculate your target heart rate to find out how much exercise intensity is appropriate for you. You'll also want to gradually warm up for the first 5 to 10 minutes. Take your pulse, don't overexert yourself. You're going to want to set exercise goals for 1 month, 6 months, and 1 year. I know I said it before and I'll say it again. Get a checkup from your doctor to learn what exercise is safe for you to perform. Let's talk about your physical activity routine. Your physical activity routine should have 3 components: aerobic exercise, strengthening exercise, and stretching exercise. We'll talk about each of the components individually. Aerobic exercise, we should be aiming for 5 to 6 days per week for 30 minutes. Strengthening exercise, we should be trying to do 2 to 3 days per week, while we should be stretching every single day. I would like to say that I could look into the camera and say there's one amount of intensity that would be appropriate for every single person, that would be a cookie cutter and work for everyone. Unfortunately, that's not the case. The level of exercise is going to be different for every single one of us. And you should begin an exercise regimen at an intensity that you perceive to be light to start off with, and then work more toward a moderate intensity exercise. One of the easiest ways to find out the appropriate intensity of exercise is what we call the talk test. And the talk test is, if you're able to sing while you're doing your exercise, that exercise may be a little bit too easy for you. Oftentimes when I'm working with patients, I have them sing the alphabet. If they can go from A to Z while only taking a few rest breaks for breathing, that exercise is probably too easy. If you're able to talk, as I'm talking to you right now, without gasping for air, that's moderate exercise, and that's an appropriate level exercise. If when you're exercising, you're gasping for air every few sentences, that's going to be considered too strenuous, and you're going to want to decrease the level of intensity of your exercise. If you are exercising, you should be keeping an eye out for some signs and symptoms of overexertion or overdoing it. Some of the common signs and symptoms of overexertion that you should be looking for include shortness of breath, nausea or vomiting, irregular heartbeat or maybe a fluttering in your chest, excessive fatigue. If you're wiped out for several hours or days after exercise, that was too much for you. If you feel faint or lightheaded during exercise, or if you're feeling pain or pressure in your chest, arm, or jaw, especially on the left side. If these symptoms do not subside with rest, or they get worse, that's when you should contact medical help immediately. Let's talk a little bit about what your target heart rate is. Your target heart rate is what you should be trying to aim for with how many beats per minute your heart is beating during an exercise. There's a little bit of math involved, but I promise it's easy math and we'll work through it together. For your target heart rate, you're going to want to take 220 minus your age, and then we're going to take that number and multiply it by 60% as you see on the screen here. For example, for a 40-year-old person, you would take 220 minus 40, that person's age, and that will equal 180 beats per minute. This is your absolute safe maximum heart rate. We should never be going above this level. And you will see that this changes as a person ages. You'll then take that maximum heart rate, 180 beats per minute, and multiply that by 0.6 or 60%. And that will get your target heart rate, which is going to be 108 beats per minute for a 40-year-old person. That's what you're aiming for. When you're exercising, you want to stay close to this heart rate, but don't exceed it. So how do we determine our heart rate? Well, it takes a little bit of practice, but we should be trying to work on checking our pulse. We want to check our pulse with our middle and ring fingers at either our neck or at our wrist. You can see on the screen that when you're checking it at your neck, it's going to be just to one side of your windpipe, or at your wrist, it's going to be just down from your thumb in the crease of your wrist. You're going to want to gently feel for a pulse, and you're going to count the number of beats for 15 seconds. The count begins with the first beat, which is counted as 0, and then you're going to multiply your 15-second count by 4 to calculate your amount of beats per minute. And again, with the intention that when you're taking your heart rate and exercising, you're trying to get to that target heart rate, which again, for a 40-year-old person was 108 beats per minute. Some people have a hard time working on getting their pulse. There is also a procedure called rate of perceived exertion, where you're going to subjectively rate how tired you are or how exerted you are during an exercise. You can rate your fatigue level from 6 to 20, 6 being not exercising or not fatigued at all, to 20 being very, very fatigued. So for example, if I'm just sitting here chit-chatting with you, I might be at a 6. If I just got done running a marathon, I'm probably going to be at a 20. So if I'm exercising at a nice even pace, and I'm exercising and I'm kind of tired, I might rate myself as a 12. What you can then do is add a 0 at the end of that 12, and that will actually equate to, in general, how many beats per minute you might be exercising at with your heart rate. So you'll compare this to what your target heart rate is and say, if I'm at 120 because I'm rating myself as a 12, that I would have to drop it down a little bit because my target heart rate is 108. There are certain times when you want to avoid exercise. You want to avoid exercise if you have any type of infection or if you feel dizzy or unstable. The last thing you need when you're exercising is to fall and hurt yourself. If you have a fever, if you're a cancer survivor going under treatment for cancer and had chemotherapy within 24 hours, not a great time to exercise. If you have low blood cell counts, that might also not be an appropriate time to exercise. Or if you have not had a chance to talk to your doctor to determine what exercises are safe for you yet. Now we'll go specifically into the different types of exercise. The first one we'll talk about is aerobic exercise. Again, we're going to be aiming for aerobic exercise about 5 to 6 days per week for about 30 minutes each. Remember, it doesn't have to be 30 minutes all at once. It can be broken down into smaller components. Aerobic exercise are things that will get your heart rate up and your respiratory rate up, where you're breathing a little bit harder and will be exercising at a safe pace for you. Some of the examples of aerobic exercise might be brisk walking, biking, swimming, dancing, even sporting activity. Some people commonly think of aerobic exercise as stationary equipment like bicycles, treadmills, stair steppers, or rowing machine. These are all great examples of aerobic exercise. The next component of exercise is strengthening. This is where you're going to build up your muscles. There's lots of different ways to do strengthening exercise. Some common ones that you might see are exercise bands. You might do some resistance training like weightlifting or dumbbells. There is also body weight resistance. You can do things like squats or push-ups against a wall if a push-up is too hard for you, or lunges. General guidelines for strengthening exercise, we don't want to do these every day because we want to give your muscles a chance to heal and recuperate. Generally, you want to exercise for strength 2 to 3 days per week, performing about 3 to 5 exercises, including your arms and your legs and your trunk muscles, for about 10 to 20 repetitions of each. Avoid holding your breath. A good person to contact to help you figure out what exercises are safe for you are a physical therapist. Finally, there's stretching exercise. Stretching exercises should be performed every single day. These are what we're going to be doing to elongate our muscles, to give them increased flexibility. So we want to gently stretch our major muscle groups daily. This will be your legs, arms, and chest and back. The general guidelines for stretching exercise is you want to do them every single day, holding each stretch about 30 to 60 seconds. I'd rather have you hold a longer stretch and a longer duration and less intensity. Be gentle and be nice to yourself. You'll want to stretch 2 to 3 times for each major muscle group that you're stretching. And remember, it's not no pain, no gain. Some people are also taught when they're stretching to bounce. Bouncing is not appropriate for stretching. You want a nice, gentle stretch. So an overall example of an exercise program. You want to warm up for about 5 minutes at a nice, easy pace. Nice and gentle. Be nice to yourself to wake your body up and get ready for exercise. You want to exercise for 20 minutes at a moderate intensity. Again, you're going to be checking your heart rate. Try and achieve that target heart rate that you set for yourself. And cool down for 5 minutes again at that nice, easy pace. And you'll finish with a nice, gentle stretch of your major muscle groups of your body after your muscles have warmed up. Stretching is a little bit more effective after you've exercised because now your muscles are warm and more flexible. After your exercise and you've cooled down and stretched, you're going to check your heart rate and your fatigue level. Record your progress. Write down how you did and when you did it. Keep up the gains and don't give up. If you take a few days off or forget to exercise, get back on that horse and start exercising again. This needs to be a lifestyle change, not a short-term diet. Energy conservation is another important topic when we're talking about cancer survivorship. Energy conservation is an activity philosophy that will help you to maintain your present level activity and give yourself proper time and energy for exercise or other outside interests. One of the key concepts of energy conservation is work simplification. Work smarter, not harder. You might give yourself more frequent breaks or try and find new and innovative ways to do physical tasks that don't require such energy expenditure. There's some special considerations I want to talk about when we talk about cancer and its treatment. If you have one of these conditions or another condition that you're worried about exercising, you can still exercise. Beaumont has a program called a Survivorship Exercise and Wellness Program that will help you start and sustain a safe, effective, enjoyable exercise regimen. You can find on this slide the link for Cancer Survivorship Exercise and Wellness Program at beaumont.edu/cancer-survivorship. We have cancer survivorship programs at our Troy campus, Royal Oak campus, and our St. Clair Shores campus. One of the topics I want to talk to you about today is lymphedema, and lymphedema is a swelling of an arm or a leg after a cancer treatment. If a person has lymphedema, exercise may decrease the risks and side effects of lymphedema, but you should consult with a physical or occupational therapist for which exercises for strength, flexibility, and cardiovascular conditioning are appropriate for you. You should monitor for increased swelling and let your doctor know if you do have any of these symptoms, and then we can get you into an exercise program. Surgical wounds. Oftentimes after a procedure, you'll have a surgical wound. Should always get your surgeon's permission to exercise before incisions are healed. You're going to want to avoid exercise if there are any signs of infection. For example, after breast cancer, if a patient has a lumpectomy or mastectomy, exercise is important, and patients can often begin gentle exercise immediately after their procedure while increasing the challenge of them after any drains are removed. But again, you'll want to get that surgeon's clearance before you start your exercises to make sure you're doing the right ones. If a person has had a procedure or treatment after cancer, the risk of infection is generally higher. This might be in cases of chemotherapy or immunotherapy treatments that might lower blood count levels. It's a good idea to avoid public places that may not be cleaned regularly. Avoiding spas or hot tubs, if you're in one of these situations, it may be best to exercise at home or in an exercise environment that might be very clean, such as Beaumont's Exercise and Wellness Program. Another common side effect after cancer or its treatments is deconditioning. Exercise is safe if you're deconditioned and highly recommended during and after cancer treatment to avoid deconditioning. If you do have deconditioning, you want to start slowly and slowly increase the challenge. Be nice to yourself. Just kind of incrementally increase your activity level. If at any time your dizziness increases or you feel unstable during your exercise routine, this may be caused by low blood counts, low blood pressure, general deconditioning, medication side effects, or hormonal changes. It's a good idea to modify your exercise to lessen your symptoms, including sitting down or even laying down to do certain exercises, or decrease the time or intensity. If this is something that's affecting your functional status or you're worried about your safety, you should contact your doctor or your physical therapist. Pain is a real issue with folks with cancer. Talk with your physical or occupational therapist or doctor to determine which exercises will help with your particular pain symptoms and which to avoid. Scarring is another issue that you might find after surgery or radiation. This may interfere with exercise, but oftentimes the exercises that you choose can be modified to still accomplish your exercise goal, and they'll actually help with scarring. Again, speak with your healthcare professional to figure out which exercises are going to be best for this. Some cancer treatments, such as radiation or surgery, can cause your skin to be more fragile in certain areas. Sometimes exercise may be irritating to those specific areas. It's a good idea to wear loose clothing, avoid excessive sweating, and if there are sensitive areas, consider wrapping an irradiated area with gauze so that you're not getting friction from your skin or clothing rubbing against each other. Beaumont offers specialized programs designed for cancer survivors. There are physical therapists and occupational therapists with specialty training in oncology rehabilitation. They work very closely with your physicians to create an individualized wellness and exercise program. Beaumont offers a free exercise screening to determine the best possible exercise program to meet your needs. The goals of these programs are to improve your movement, give you better balance, promote fitness, and support a healthy lifestyle. Some common types of interventions might be a supervised exercise program, an individual wellness program, or traditional physical or occupational therapy. The supervised exercise program is overseen by a physical therapy clinician with the goals of fun, fitness, function, and friendship in a group setting. This would be before, during, or after cancer treatment. An individualized wellness program will constitute a fitness evaluation and an individualized exercise or activity plan that you can work on at home in a fitness center with the reassurance that you have the exercises that you need to avoid further exacerbating your condition or injuring yourself. Finally, more traditional physical and occupational therapy might be prescribed if you require more specialized care. Traditional physical and occupational therapy include treatments for range of motion, muscle weakness, exercises for urinary or fecal continence in men and women, pain management, lymphedema management, training for balance, modifying activities of daily living and environments to maintain a high quality of life, and other treatments focusing on a person's specific impairments or functional limitations. Did you know that Beaumont has physical and occupational therapy right around the corner from you? There's Beaumont Medical Center in Lake Orion at 1455 South Lapeer Road in Suite 123 at Lake Orion, Michigan. You can see on this slide the map and a picture of the building. Contact them if you need anything. There are also additional resources that will be available to you. Beaumont Health has resources at beaumont.edu/cancer-survivorship or beaumont.edu/rehab. There's also resources at the American Cancer Society at cancer.org. The American Physical Therapy Association has a website called moveforwardpt.org, and the American Occupational Therapy Association is aota.org. You can see all the links on our slides. Finally, leave you with a few parting words. A journey of 1,000 miles starts with a single step. Let us help you take that next step in embracing a healthy lifestyle. Thank you so much for your time, and good luck.